Hi, my name is Dr. Winnie Nyanya, a public health specialist specializing in HIV care. I've partnered with Ponea Health today to talk about HIV awareness. Once you are diagnosed to be HIV infected, what you can continue living your life as normal as possible, although you'll have to make some steps to live a healthier life, and this means that we need to do what generally is accepted to be the healthy steps that we need to take. The first one is exercising. Make sure that we are mentally able to address whatever issues, we avoid stress, we have good sleep, and we also take our treatment well as expected. We need to avoid things to do with drugs and alcohol because those can affect your treatment and affect your treatment outcomes. And we need to ensure that we take our treatment well so we do not miss taking our treatment and we do not miss any clinic appointments in order that we are able to be guided well by the healthcare provider. We should avoid also taking any other medication that is not prescribed by your healthcare provider so that the healthcare provider can know what other treatment you're on and support you well. We also have populations that would go for either prayers or other forms of traditional treatment. You're advised against it. While you're probably going for prayers and other forms of support, it would be important to continue taking your treatment to ensure that you're suppressing the virus as expected. HIV infection does affect other aspects of one's health if the HIV is not managed. The virus causes lowered immunity, and with lowered immunity comes other illnesses that are called opportunistic infections. So when one's immunity is lowered, they are prone to illnesses like common cold and flu, other skin conditions, TB, malaria, diarrheal diseases, and many other diseases that could also be life-threatening like cancers. So one's immunity needs to be maintained at near normal as possible so that they prevent the opportunistic infections and other illnesses associated with lowered immunity and HIV infection. To avoid opportunistic infections and other infections associated with the lowered immunity when someone is HIV infected, the most important thing is to adhere to treatment. When we adhere to treatment, we reduce the viral load to a significantly low level where we are not able to, our immunity is not affected, and the other opportunistic infections do not come in. So one must be able to adhere to treatment, and also if they are not feeling well, they need to inform their healthcare provider in good time so that they can get treatment and we are able to manage any opportunistic infection. If you are HIV infected, it is possible to have a relationship with someone who is HIV negative and even have a family with the person who is HIV negative, and there's a possibility that the children will be born to be HIV negative. This is through the support of healthcare providers who will help you to know when is the best time to get pregnant and help prevent transmission of the virus to your partner, and they will also help you through the whole pregnancy journey, through delivery, and also the breastfeeding period. And these are periods when HIV transmission can happen either to one's partner or to the child. So this is possible. We have situations where an HIV-infected person is in a discordant relationship with an HIV-negative person, and they both have children, and the children also are negative. So this is very possible with the help of a healthcare provider. Thank you for joining me in this discussion. You can book my services at poneahealth.com. I look forward to engaging with you more in the next episode. Thank you.